I'm Bill Hendee. I'm co-director of this program along with Cynthia McCullough and Diana Cody. And it is my pleasure to welcome you here on behalf of the Technology Assessment Initiative, which is an activity under the Science Council of the American Association of Physicists in Medicine, which are the hosts for this conference. We want to express our thanks to two organizations who have helped us in the funding for this conference to try to keep the registration fee down so that it's not an impediment to your attendance. You obviously can appreciate that the cost of this meeting is far greater than what we charge back to the attendees for registration fee. And those organizations, those organizations that have helped us are MITA, the Medical Imaging Technology Alliance, the American College of Radiology, and this meeting is also endorsed by four other important organizations, all of which are represented here: the CRCPD, the RSNA, Radiological Society of North America. CRCPD is the Conference on Radiation Control Program Directors, the Health Physics Society, and the American Board of Radiology Foundation, all of which are endorsing this organization. Again, welcome. Thank you for being here. Out of consideration for others, this is a good time to mute your cell phone or turn it off. And if you have personal belongings, please, and they're occupying a chair, please put them on the floor. I don't think there are any of those. It looks like we have a full audience here. We have program objectives. I'm obligated to tell you what they are. At the end of this meeting, we hope that you will be able to identify the trade-offs between image quality and CT and dose associated with common scan and reconstruction parameters, that you will be able to recognize common technical and clinical errors in CT imaging, and you will appreciate the characteristics of high-quality head, body, and cardiovascular CT scans. You will be familiar with multiple dose reduction strategies, including patient size adaptation, and you will understand the roles and responsibilities of the various members of the imaging community for CT protocol development and optimization. Those are our objectives. This meeting closed out registration 6 days after we opened it. There are many more people who are not here who wanted to be here than who are here. Therefore, I have to congratulate you for being prompt in your registration. It was obviously very successful. We have a lot of different people from different backgrounds at this meeting. We have medical physicists, we have radiologists, we have technologists, we have administrators, we have representatives from industry, and we have regulators, all of whom have an interest in this particular topic and all of whom recognize its importance. I have to say two things. One is to the speakers. This is a very packed agenda. You absolutely must not go over your time. And if you take all of your time, we will not be able to entertain questions on your talk. I also have to say the same thing to the moderators. You must keep the program on time. We are prepared, the moderator is prepared to come up to the podium and push you off the podium if you are a speaker and you go over time. And we have carefully chosen very large moderators. We do hope that we have time for questions. There is a floor mic, and the process will be for you to walk to the center aisle and to the floor mic to ask your question. And the reason for that is that we are recording. We are doing a video recording of all the slides and all the talks and all the questions and answers. And that will be available through the APM website. So you'll be able to hear the talks and see the slide presentations. We will also have the slide presentations in PDFs mounted on the public access side of the APM website. So you will also have access to the slides. There will be a charge for accessing the video for non-APM members, a small charge. We don't know quite what it is, but we will figure that out in the next few days. All the slide sets will be available free. So with all that, thank you for being here. This is going to be a very interesting 2 days. It's intense because the topic itself is so important. I'd like to turn the program over to our first moderator, Tony Seibert from UC Davis.
Thank you very much, Bill, and good morning, everyone. I'm here partially on behalf of the AAPM. And it is indeed an honor and privilege to be representing the American Association of Physicists in Medicine in welcoming you to this CT Summit in Atlanta. On behalf of Michael Herman, who's the president of the AAPM, and in conjunction with the AAPM Executive Committee, the Science Council under the direction of John Boone, and in concert with Facilitator Extraordinaire Bill Hendee, co-program directors Cynthia McCullough and Diana Cody, and all of the faculty are open this 1.5-day session. We're packing 2 days into 1.5 days, actually. Session. And it's in response and organized with respect to the recent media attention brought out by the CT overdoses that have occurred, the significant increase of CT utilization brought about by technological advances and clinical benefits, and an increased awareness of radiation dose by the general public. I would like to recognize, and Bill has already done this, so I'll just keep this really short, co-sponsoring organizations that have contributed financially and substantially to this event, including the Medical Imaging Technology Alliance. You know, that's one of the questions that I asked everybody, is it MITA or MITA? I asked Steve Vastag, who's at the back of the room, and he said, oh, it's MITA. So that's one of those things we'll have to come to some sort of consensus and standard on in how we pronounce that name. The American College of Radiology, endorsements from the RSNA, the CRCPD, the American Board of Radiology Foundation, and the Health Physics Society. We really appreciate all of those contributions. Definitely this is an intersocietal and regulatory agency effort, and we're very happy to have the FDA represented through this Center for Devices and Radiological Health as well. As we're all aware, technological advances of CT have resulted in many new clinical applications that have often outstripped the ability of application specialists, users, operators, regulators, and diagnosticians to train, operate, regulate, and properly understand the nuances of these sophisticated acquisition and diagnostic capabilities. Huge gaps have evolved between the use of the equipment and the clinical utility of the examination and patient safety. Therefore, we have recognized as physicists that we kind of own a lot of these problems, and there is an urgent need to analyze and close the gaps through a multidisciplinary approach, namely to improve communication amongst technologists, physicists, manufacturers, and regulatory agencies, to recognize the need for vendor and equipment-specific education and training programs for proper use and safety with readily available materials and online training modules, to foster improved understanding of the benefits and risks of new technological capabilities that these systems provide, to compare techniques, protocols, and reference doses in a collective optimization effort, and to cooperate and share ideas and experiences. We continue to want to do that throughout the next couple of days and for the foreseeable future. Now, with respect to a little bit about what the medical physicist has to do, the qualified medical physicist plays a key role in all aspects of the clinical operation of computed tomography and is responsible for the acceptance, calibration, and verification of safe operation relative to radiation dose and oversight of acquisition protocols. Recent events have heightened the importance of this input and oversight, and it is important that the medical physicists step up and play a proactive role in the implementation. Many of the presenters in this workshop will touch upon these issues, no doubt. Another area of high importance is to begin the development of a consensus and consistent practice for CT, and to improve vendor-agency, i.e. the FDA, interaction. Certainly it is in the users' and patients' interests that the manufacturers provide better software and hardware tools for patient safety. There is no doubt that changes are already underway. To reiterate these themes that I've just talked about, there are 4 items of major importance, and Mike wanted me to make sure that everybody knew from the President's perspective what we're thinking about in the AAPM. The need for properly educated and qualified individuals. This includes certified CT technologists, qualified medical physicists in diagnostic imaging with an expanded role in the oversight of CT, physicians trained and credentialed in CT, and accreditation of all CT programs and practices. The need for consensus and consistent high-quality practice standards to provide appropriate, safe, and effective patient care. The need for national reference dose standards for CT procedures and national event reporting when things go awry. The need for a better process with manufacturers and the FDA for equipment approval and clinical implementation to ensure safety and efficacy of patient procedures. On this point, the AAPM and other organizations are investigating the possible implementation of an independent technology assessment institute as an entity to meet some of these needs. So in conclusion, these brief introductory remarks, the proper use of CT in the clinical environment requires three things: justification, optimization, and oversight. And I know we're going to hear about all of these types of things throughout the next day and a half. And with that, I am going to close and welcome you all to the CT Dose Summit. The AAPM, co-sponsoring and endorsing organizations look forward to a productive and worthwhile workshop with you and for you, the participants. Thank you very much for your interest and attendance. I'm looking forward to it myself in the participatory characteristics of this workshop.